Hi, this is Ashley with the International Sports Pharmacists Network. Dr. Jamie Wilkey is going to join me again today so that we can talk a little bit more about pharmacist confidence. Welcome, Dr. Wilkey.
Thank you, Ashley. I love talking with you.
So last time we touched a little bit on the subject of pharmacist confidence, and I've thought a lot about that since we had that discussion. And I spent some time through the editing process of that video and really thinking about what we had said and little conversations we've had on the side. And there was a lot of hesitancy that I actually had in posting that video because when it comes down to it for me, I don't think that pharmacists as a profession lack confidence. Like, they are very self-confident people. So I wanted to open up the conversation and ask first if you've thought anything more about that, or have you had any incidences in your job or life that have made you think a little bit more about this?
Yeah, so I think it's two different kinds of confidence is what I see, because I feel like pharmacists are confident in their knowledge in being pharmacists. We're really good at that. But where I see the hesitancy and the nerves and the imposter syndrome is when we're going out and doing something new and maybe selling our services or putting a price tag on it, because in all the traditional settings, we just give all of our information away for free. And so where I see a lot of trouble with confidence is to be charging for your services and or be doing something new and different, because we have a profession that hasn't changed for a long time in so many cases.
Yeah. In a presentation that I was in just yesterday, one of the presenters said, pharmacists like to follow the rules. And, the rule is there. And we're like, well, why would we not follow the rule? And that's just kind of how we are as a profession. If those boundaries are set for us, we tend to stick within them. And so, that's what I've been thinking about a lot is, especially with all, there's a lot of talk about imposter syndrome. And I think that is a perception that other people have of you that you then allow yourself to become. And once you move outside of, what they have assigned to you as an image, then you actually can begin to move beyond that. It's not that they lack confidence. It's just taking that first step, like we talk about every time. It's not your degree that's going to help you move forward. It's actually you as a person.
Yes, exactly.
I do have questions for pharmacists as to whether or not you think that when we're oftentimes trying to prove our value, like what's the pharmacist financial impact on the patient outcome? And I do wonder if that's the right metric for us to really be evaluating, because so often individual people are looking for the relationship. I'd love to explore that idea as we move forward with so many pioneers in pharmacy. What's our true value? Do we have to put a dollar sign on it? And if we do, why aren't we paid equivalently to other healthcare providers for our level of knowledge? The pharmacists that you've been working with, they've gone through your academy. What do you see as commonalities among the ones who end up becoming most successful?
They take action and they just open their mouth and tell everyone what they're doing, why they're doing it. And truly, those who just take action, even if it's not perfect, even if they don't have everything figured out and just know what they want and are figuring out how to get there along the way, have the most success. Those who are frozen in the background, working on their perfect PowerPoint to get in front of a doctor, are frozen in perfection and just getting everything right before they open their mouth, when really you just got to take action, because action many times cures fear and opens up a network of possibilities that you don't know are there until you own who you are and what you do and how you can help people.
Yeah, so this makes me think of just a couple days ago, I decided to record my elevator speech. for a job that I don't even have yet. And so I recorded myself on my cell phone over and over until I felt like I had my elevator speech just right. And it ended up being 26 seconds long, and I felt very confident about it. And I was clear about what I would be doing, how I would be valuable, how I would change patients, and what my ethics are. And I was like, I just said all that in one sentence, and I think once we get that vision clear, that really helps too with, if you can tell somebody, even if it's not your current career, this is what I'm going to be doing real soon, that having that clarity for yourself really does help. And recording it and playing back to myself was really helpful too. So do you have an elevator speech for yourself?
Yeah, and that's what I teach my students to do. Like, say out loud when you're driving in the car what you do. It sounds so simple, but if you can't say clearly and articulately and confidently what you do, it's such a simple thing, and it gets your mind in the game, and it helps when you're talking with people. If you are fumbling for words and like kind of vague, then it is hard to convey what you do and why you do it. And so not only for you, but those who you're communicating with, to have a sentence you can say without thinking or fumbling or acting not confident is huge.
Right. Yes. Yeah. And rehearsing it makes all the difference.
Yes. And just saying it out loud. It's such a simple thing, but we're just in our head so much and our thoughts get so jumbled that it's easy to really not have that clarity.
Along that same line, I also find that some patients don't actually know the depth of education that we do. Like, they might see that we have a PharmD, or those of us who have a BS and have practiced forever, and they might not recognize that it takes basically just as long as a doctor going to school to become a pharmacist. And sometimes also expressing that you have that much education helps create that level of trust as well. So with the patients or with providers that you plan to work with. So finding a way to verbalize that is really helpful as well. In a humble way, not in some kind of showy, egotistic way.
Yeah, exactly.
Yeah. And then, so what other tips or tricks do you have for pharmacists who are trying to make that step out there? I mean, we've talked a lot about like, just make the step, just take that first action. What do you recommend as their first action they should take?
Just brainstorm what they like to do and what's interesting to them, instead of focusing on where you can make the most money or what you think could work in your community. Just find out what you like and you're genuinely interested in, because you're going to be dealing with the topic a lot and can make it work in your community, in your area, but you've got to find something that at least is somewhat interesting to you and you have a natural affinity for, because if you don't like it, then you're not going to stick with it. And so
somebody recently asked me, how much time do you work on sports pharmacy? And I was like, oh, between 5 and 20 hours a week. That's the nice thing, I set my own schedule. And I was like, well, but I do a lot of reading outside of that, and I'll read some articles before bed, or, I'll definitely answer some emails when I'm not in my business hours. And so, but it's because I'm truly interested in that subject. And so when something new pops up, or, a friend sends me a link, or somebody asks me a question, I feel like, ooh, I want to research this and respond. And so, that obviously does make a difference if you're passionate about it. And then people begin to look at you as their go-to person. So, but you do have to be willing to step out of your comfort zone a little bit and answer questions, and sometimes be off the record. Well, any other tips that you would recommend?
I would just say keep an open mind and use the resources that are available in 2021. Listen to podcasts, get on LinkedIn, just see what's out there. For so long, I had no idea you could do so much in pharmacy. I was one of those people because I just didn't know. And I wasn't in those spaces. I wasn't consuming those books and those podcasts and that material. And so even if you feel like you have no idea, but you want to change, just start seeing what's out there and come at it with a curiosity. And it's pretty cool that there's so much within pharmacy that will likely resonate with you. For a long time, I thought there's nothing in pharmacy I actually like. It's just a job.
Yeah.
But there is. You just have to give it a chance and really investigate.
Yeah. Yeah, even just within sports pharmacy, I had come up with a plethora of different areas where pharmacists could be of service. And they definitely cross over into surgical centers and ambulatory care and, all different areas that pharmacists already do. So I think when pharmacists really start to think outside of the chain pharmacy, that they will be able to see where they can expand. So, just pushing their own envelope a little bit does help open some doors. So,
yes, absolutely.
Yeah, great. Well, thank you very much again for your time today. I would love to hear anybody's questions or comments below. And please like this video, subscribe to the channel, and share it with anyone who you might think benefit. Visit sportspharmacist.org for more information. Thank you.
Well, thank you for your time, Ashley.